Okay, can you see the slides?
Yep.
Today we are going to discuss medical technology laws. Um, those of you who are in advanced courses, they might have studied medical laws. I know that in Tashkent State University of Law, you have a master's in medical laws. Uh, I don't know about the curriculum of this program, but I am sure that they don't teach medical technology laws. We all know that there are number of advancements have been observed in the area of medical technologies. Not long before, you might have seen a video circulating on internet that there was a surgeon. He was sitting in London and he was operating on something in New York by using telemedical robotics. So it has become practically possible that doctor is sitting in another country and he can do operation in another country. And this is all because of the medical technologies and innovations in the area of medical technologies. The the United Kingdom has so many interesting laws related to medicine. And just for the sake of information, I wanted to show you something which is very interesting. Let's see if this link opens. So can you see this?
Yep.
So this is UK National Health Service Law, which is recently passed. And here you can see a list of laws related to medicine which United Kingdom has passed. So just start from the most recent one. Access to Health Records Act, Access to Medical Reports Act, Autism Act, Cancer Act, Care Standard Acts, Carer, Children Act, and you know a number of laws related to health has been passed, and Health and Social Care, Health Protection Agency Act, Human Organ Transplant Act, what we were discussing yesterday about organ transplant, Human Tissue Act,
Mm.
uh, Optician Act. You know, optician, it is eyes, related to eyes. So law related to eyes and the doctors who deal with the eyes. Osteopaths, you know, osteopath, it is related to the bones, the people who deal with the bones. And you know, one of the oldest laws are poor laws of 1601. So many laws related to the medicine. Only one country, UK, has passed. Do you have any information how many laws related to medicine Uzbekistan has passed?
None. I guess.
No, there should be laws related to medicine. But the point which I am trying to make is that this is a serious area of legal sciences, and those countries who realize the importance of healthcare, they regularly, you know, upgrade their legal system, and they introduce new laws. For example, if I am not mistaken, COVID-19 laws, UK. UK had also passed a coronavirus related special law, coronavirus legislation, when the coronavirus came. I mean, the process of legislation is very fast when it comes the to meet the demands of modern era. So you can see they passed a Coronavirus Act 2020. Means when they realized that it is the need of the time, they did the legislation, they speed up the process and they completed this law, and you can see that it is very detailed law related to coronavirus. Yes.
Yeah,
So
and also I googled it and I found that there is a law in Uzbekistan about the medicines and pharmaceutical activities.
yes, maybe it is a procedural law, but these laws which I have shown, they are very rich in substance, and the countries, they try to meet the demand of the advancements in medical law. So I want to show you one more interesting website which gives different topics related to medical laws. And on this website you can see, because I couldn't find a better website, you can see how many topics are related to medical law. uh, Abortion laws and legislation, AIDS, allied health personals, assisted suicide, bioethics, bioterrorism, children with disabilities, cloning, communicable disease. Means these are all topics related to medicine and law. So if you want to explore a career in medical law, you can select just one topic and you can find enough material to write your thesis on, or these are the contemporary issues. Okay. And if we talk about some of the emerging areas, these are medical tourism, medical policy, medical ethics is an ongoing area. So in neonatology, right to die is an area where people are writing lot many theses. So you can see that how many topics are there, and all of these topics they are there for you to write. Someone is saying slide is not clear or not visible. Can you see this website which I have opened?
Yes.
Yeah.
Why it is
Yes,
not?
yes. It
Why
has
it is
been
not
visible
visible?
now. So
Okay.
far, it wasn't visible.
Yes. So these are different areas, and all of these areas are related to medicine, and all of these areas they are related to the law. For example, a donation of organs and tissues, what we were discussing yesterday. Yes. And genetic engineering, which some of you asked me yesterday. So you can later explore this website and you can click on one of these topics and you can study more. Okay. So this is something which is very interesting. This is called as autonomous robotic surgery. This is happening at a number of stages. For example, the doctor stands beside the robot and robot does surgery. Can you give an example of this? It is happening in Uzbekistan also. Did you see something happening like this?
Honestly,
No, I
no.
haven't.
Actually, what about eye surgery when robots just shine the ray to eyes to humans' eyes?
Yes.
It's a process or surgery, maybe.
Yes, this is what I was going to say. It is happening in Tashkent everywhere. Almost all the medical eye clinics, they have this technology to correct your eye vision. You can go, you can lie down under the machine, and just in 5 minutes they can the robot can do this surgery by itself, and doctor is there just to monitor what's happening. So this is autonomous robotic surgery, but there are some robots who does these type of surgeries by their own. I mean, the doctor is not even there. Or in the beginning of the lecture, I gave you an example that it is possible for doctors to do the surgery from a distance. For example, patient is in New York and doctor is in UK, or the doctor is in New York and the patient is in Tashkent, and by using robot he can perform surgery on it. By This is an advanced branch of telemedicine. So this is something which is happening now. The question is that if something went wrong, who will be liable? I mean, if robot does something wrong, who will be liable? Robot will be liable. The company who made the robot will be liable. The doctor will be liable. Hospital which has, made this robot or installed this robot, they will be liable. Or the company who has manufactured this robot, they will be liable. Who will be liable?
Doctors.
It's up to the context. If there were mistakes from the machine, the guilty is the producer. of this machine. And what I mean that the company, if they
Can you just discuss among yourself just for 1 minute,
patient,
and I will just come
doctor
back because my charger
doctor
is
should
low.
say
Okay, let me find
what?
the charger of my laptop. Let me find the charger of my laptop, and I will be just back. So you discuss among yourself.
Mostly shoulders.
So what were you discussing?
May I say, I think no one will bear the responsibility because before every heart operation, patient puts his signature on a contract that he agrees with the result of the operation. I mean, when it comes to the robotic operation, I'm sure that there will be a contract, a kind of contract, in which it would be said that patient will agree with the result if someone will go wrong.
This is called as informed
Means that even
consent.
Samandar, even you can make this surgery. Anyway, you won't take the responsibility, yeah? You won't be liable for this if something goes
Oh
wrong.
yeah, if patient doesn't want, he may отказать, как это, refuse with the operation. Operation isn't obligatory.
So, okay, it means that
No,
if someone dies,
he signed,
no
he
one will
signed
be
the
guilty,
informed
yeah?
consent. He signed the informed consent uh, on these terms that everything will go fine because he took feedback from other patients. But what happens that this machine have some sort of fault in it, or it performs something by its own by using his own data, and it is possible that you were the only patient on which this robot perform a wrong surgery. In this case,
The company will be guilty.
simply the company will be guilty.
Yes, because
I think doctor will be guilty because doctor was watching doctor was watching the operation and he had to regulate the robot if he went wrong. I think doctor should be punished.
no, they were mistakes inferior of the
Okay,
machine.
so just keep thinking about this, and there are a number of things which you should keep in mind. First of all, the technology which is being used. At present, I don't think that we have 100% autonomous robot. We have very advanced robots, but there is some sort of human involvement at any level when it comes to the autonomous robotic surgery. So we cannot say that we have a robot which can do everything by its own without any human involvement. Okay, so just keep in mind the technology as well, at which level you are talking. And then you can think more about this topic because it is very serious and many people are writing on this. This is another interesting area which is called as nanomedicine.
But may I ask one question?
Yes.
Usually we ask for the punishment when we want someone to realize he's guilty. So if doctors, for example, make something wrong, we'll judge them, we'll sue them, and while in the prison, they will realize maybe, yes, what they have done. But if we can't sue the robot itself, and if he is guilty and will sue it somehow, in somehow way, he won't realize. For maybe future, when they will have consciousness, they will somehow realize. But now at present, they won't be able to realize they're guilty and to, how to say it in English, исправиться.
So, you know, when it comes to the technology, it is very easy to install emotions inside the robot. I mean, it is not a problem to install emotions inside the robot. We can install emotions. There are some
But
advanced robots. There are robots which can feel the pain. There are some incidents. There are some incidents. Hello, can you hear me?
Yeah.
Why there is this sound?
But I have heard about one research. There was a woman who was a scientist, a neurobiologist, and she was talking about animals, how they feel, can they see the colors. And she said that we can't surely say this. So in the case with robots, can we say for sure that they feel these emotions? Maybe we just lie to ourselves,
No,
and maybe we just think that
it is the question of technology, and technology has become very advanced. The point which I am trying to make is that if you want to punish the robot, it might be a problem, but it itself is a very big punishment for the scientist who has prepared these robots, that he is unable to use his scientific innovation in future. If you just go on Google and you can type Facebook's artificial intelligence robots shutdown. Just write this: Facebook's AI robots shutdown, and you will read this news. What happened in 2017? Two robots of Facebook, they started talking to each other in their own language, and Facebook employees, they didn't know what is going on, and ultimately they shut them out because they didn't know what they are talking about. Okay, so one punishment for the robot is to turn it off as Facebook did, but I personally think that it itself is a very big punishment for the robot, that it is unable to operate in future, and it is a punishment for the scientist as well, that he is unable to use his technology in future. The more interesting thing is that the level of autonomy, I don't think that the scientists themselves are willing to give the 100% autonomy to the robots. And if they are willing to do this, it will take a lot of time. So let's wait and watch what's happened. At present, the maximum punishment what we can give to a robot is to turn it off, or we can make strict rule and regulations for the scientist or the company who is experimenting on these robots to limit the use of such sort of robots. But your question is legitimate, and we will wait and see until we will have such practical cases. The other area which I am going to talk is nanomedicine. Nano, as you can see, very small, and they are being used everywhere, and every day you can see different news on internet that scientists have made a small pill or capsule, and you can inhale this or you can eat this capsule, and this will go into your stomach and it will give you the images of your inner world inside body, and scientists can use them for diagnosis. There are other number of vaccines which are being used based on nanotechnology. And then we have this regenerative medicines, means the old people, their cells they die, but we have stem cells which are fresh as compared to the old cells, and you can make new cells by using your stem cells, and then you can install them inside the human body. Similarly, you can use these nanomedicines for those patients who are suffering with infertility and so on. So these nanomedicines, they are bringing different challenges as well for legal scientists. And I think that you can imagine different types of challenges coming when the nanomedicines will be there. Sometimes it happens that people are not willing to accept a very advanced technology in terms of medicine. For example, in Pakistan, polio was a disease, and polio, it effect on the bones, it weakens your bones. And World Health Organization had a very big project to do the polio vaccination in the northern areas of Pakistan. And someone in the northern area of Pakistan, some moldu, some mullah, told to the people that these people who are infidels, means they don't believe in God, they want to give you this polio vaccination, but their original purpose is to effect on your fertility. I means he told to the people that if you will take this medicine, if you will take this vaccine, you will not have babies. And this is something which kafirs or infidels, they want, that Muslims shouldn't have babies. And those people, they believed on this. And then number of incident happens that the WHO teams went to the villages to give the polio vaccinations, and people started firing on them. So it is very easy to politicize, or to, it is very easy to, how to say, to make people emotional on the name of new emerging technologies, no matter it is medicine or not. So you can imagine that these are some of the things which are happening. You can also imagine that maybe these things will happen in reality, that certain countries will use nanomedicine technologies and install some kind of spying devices in your tablets or capsules, or in your injections, and they will inject in your body, and then they can monitor your activities. So it is possible in future. Are you there, or I am speaking with myself?
Yep, sure. We are
Yeah,
here.
sure.
It's like old movie, what happened in Pakistan. It's like Çalı Kuşu. Have you ever watched?
No, I didn't
Kamran's
watch.
father got
Oh my
sick,
God, oh my
and
God.
people said he shouldn't be cured. This kind of thing happened.
This is just a single example. I can give number of examples. For example, the salt, the soul has some people include iodine. Iodine is another salt. They mix this with our salt, and this iodine is useful for your thyroid. Thyroid is a gland which secrete hormones inside the body. So if you use a small amount of iodine with your salt, your thyroid stays healthy. So many companies were producing iodine mixtures mixed with salt, this type of salt for cooking. And many people, they said that this iodine salt is also introduced by infidels, by Europeans, to effect on your fertility, because this will effect on your reproductive system, and you will have less babies. And this is something which Europeans want, that Muslims should have less babies. So I mean, number of cases are there, and number of examples can be given. This is not only the tragic dilemma in Muslim countries, in India or in other East Asian countries, or even in China. There are number of superstitions. Even in Uzbekistan, I am sure that number of things are happening we don't know at certain level. So it is something which is very common. But the real and the actual concern of legal scientists is to draft a framework as early as possible, so that when the incident comes or when the incident happens, we should have a legal framework. And through the prism of this legal framework, we would be able to see at this case. Now, what happens? What is happening right now? Something bad happens, and then we make laws. What we should actually do, we should make laws in advance so that we can stop something bad happening, or we can have a legislative framework when a certain case or wrongdoing happens. Okay.
Okay, got it.
No comments. Okay. Medical cannabis, marijuana, is a very famous topic nowadays, and certain countries they are banning, certain countries they are you know certain countries they are thinking about making laws related to this. A couple of years ago, in your neighboring country Kyrgyzstan, the president of National Bank who said that we should legalize marijuana so that the tourists can visit Kyrgyzstan. And then there were a lot of criticisms on his statement, that why he said that. But we know that certain countries, especially Netherlands is very famous about it, where a certain amount of marijuana is legal. And if you come to certain part of Afghanistan, it is a common practice to use certain kinds of drugs, and no social stigmas are attached to it. I am sure that in Uzbekistan also, in certain part, certain medicines are being used for these aesthetic purposes or as a drugs. But this is a contemporary question, that should we legalize marijuana or not, or should we legalize a certain amount of drugs so that people can use them and theoretically they can feel relaxed. What is your opinion about it? Should we legalize a certain amount of drug for personal uses?
I think we have to legalize only easy drugs, which cannot hurt people's health fully. Because if we prohibit them, people try to find another way, and they will try to find a criminal way to get it. But if we legalize that, the only way people could get it, it will be by government, and the government could control all of this way how to people get these drugs.
Same goes for prostitution. Don't you think
Please
that
remove
your
it.
argument also goes for prostitution as well, that government should legalize prostitution and regulate it?
Yeah, I think so about prostitution as well.
What about others?
I think we shouldn't, because it will lead to more quantity of people who use these drugs, since it will be easier to get them and won't be any punishment for this.
Can I?
Yes, just
For example, for example, medical cannabis have been allowed for 2 or 3 years, and they are producing in our country for just medical
Medical use.
purposes, and producing purposes as producing so как сказать, soap,
на русском
soaps,
скажите.
мыло, они
Okay,
этот
so
the soaps and tablets, clothes, for in manufacturing purposes, как сказать, промышленности используется. And I also see this medical cannabis in Tashkent, сейчас сказать, in Tashkent country. There, как сказать,
Okay, okay, I understood.
in front of this cannabis were medical firm.
I know that Uzbekistan grows this cannabis only for export, not for inner use.
May I give my point?
Yes, yes, you can.
Everybody knows that the cannabis is very strong, the plant, and it can be utilized to treat some devastating or some strong illnesses. I think for this reason it should be legalized, and only particular medical institutes should take the responsibility on their shoulders. And in other cases, the usage of the cannabis shouldn't be legalized. They should be punished.
Okay, you can continue the discussion in your group.
The main point
I have opinion. So
is we should legalize for only medical practical uses.
Okay, this is an interesting, phenomena in medical sciences. These are called as hybrid products. Hybrid means this is the combination of goods and services. For example, in UK, who is sending me messages? Please don't send me messages. If you want to say something, you can use your mic, because I cannot see the chat again and again. Discussion is for the class, not for me. Okay, whoever is sending messages in chat, please speak. Okay, because I know the answers. I have my own opinions about this, so it is for the class. If you have to say something, just speak in the microphone. Okay, so
yes, someone said the cannabis isn't strong, as you
okay,
say.
we will discuss cannabis if we have time. Now we are on another topic. This is about hybrid products. Hybrid products means they are the combination of goods and services. So if you buy a good, you have to buy the service as well. For example, abortion pills in UK. So what happens that if you want to do abortion, you can buy the medicines, but you cannot eat these medicines by yourself. You have to eat these medicines in the presence of a medical practitioner. Okay, so at the same time you are buying medicines, and then you can eat it in the presence of a doctor. So it becomes a hybrid product. And then there are a number of discussions on this, that we need to allow girls to eat them whenever they want and wherever they want. And there are a number of new advancements have taken place in this area. And you can read this news: abortion pill can be taken at home in England under new plan. So this is an interesting news. You can read this, and you can see what is a medical abortion, different types of abortions, and how you can use these medicines. The point which I am trying to make is that there are certain medicines you cannot simply eat them whenever you want. You can eat them, or you can take those medicines only under the supervision of a qualified medical practitioner. Thus, it becomes a hybrid product or hybrid medicine. Many people have reservations on this. Many people, they don't want to pay for the services of the doctors. Many people think that they can eat it or they can take this medicine by themselves, but the law of the country demands them to use these medicines only under the supervision of qualified medical practitioner or qualified medical staff. In your practice, you will see number of cases. If you will go into the medical law practice, you will see it is very common that someone went to the optica medical store and he bought something and then he ate this and then something wrong happened, and then he tries to blame the optica, or he tries to blame the company who has manufactured, or maybe his doctor wrote this medicine to him 3-4 years ago, but he realized to take this medicine today when he didn't need this medicine, or when this medicine is no longer be prescribed by his doctor in normal cases. So you will see a number of scenarios in your practice. But the hybrid product, if someone asks you what is hybrid medicine or hybrid product, you can say that the medicines which you can take only under the supervision of qualified staff, they are called as hybrid medicines or hybrid products in medicine. Okay.
Yes, understandable. Thanks.
Now the regulation of biotech, technology in biotechnology. Biotech, when I graduated from college, when I completed my college, I got admission into bachelor's in biotechnology. And I studied biotechnology for one semester, one full semester and one summer semester. And then I left, and then I came to Kyrgyzstan to study medicine. So my university life started from the biotechnology. So biotechnology today has become very advanced area of medical sciences. A number of innovations are happening, and if we talk about legal challenges, so many legal challenges are there. The regulation of biotech is typically slow to respond. Why? Because the advancement in biotechnology is much faster as compared to our legal progression. The point which I am making here is that science is going, applied sciences or biotechnology, it is much more faster as compared to the advancements in our law. It is very easy for scientists to make a new medicine by using biotechnology, but it is very difficult for a lawyer to make a new law related to this. Yes. So the advancements in medical sciences are a challenge itself just because of their fast speed. No matter what the substance matter is, just because the advancements are happening at a faster pace, it is a challenge for the whole legal system, because we cannot meet with those advancements at the same speed. So embryo screening, embryo, all of you are above 18, I hope. Is anyone under 18? Useekh Wosim Nasit Ledda.
17.
Who is 17?
I am.
Okay, just close your ears. Don't listen this part. So, embryo, it is very, it is very common practice in many countries to do embryo screening. You can see what is inside the embryo, and there is a process which is called as IVF, in vitro fertilization. In vitro fertilization means they make the embryo outside of the body and then they install this inside the body or inside a surrogate mother. There are different females who are unable to bear the, a child they cannot become pregnant, or they cannot hold the baby inside their womb, and they lose their pregnancies. So what they do, they fertilize this embryo inside another body, and these ladies are called as surrogate mothers. So they take the egg and sperms of the original parents, and then they install it into a third person who is a surrogate mother, and that third person, she gives the birth to the baby. This is a common practice which is happening. So imagine a world where most babies are born through in vitro fertilizations. Doctors are given a report that outlines the risk associated with each embryo. I mean, it is possible. Just imagine that if you know that what sort of diseases your baby will have, or the science becomes so much advanced that they can tell you beforehand, before the birth of the baby, that which diseases this child will be suffering with. Uh, it is the matter of personal choice, but majority of the people, I suppose, will prefer not to have an unhealthy baby. These are some of the diseases. For example, Alzheimer. Have you heard about Alzheimer?
Yep. Yes,
Yes,
I know.
they forget about their life story and so.
Alzheimer is a psychomotor disease, and Huntington disease, it is also a progressive brain disorder. It becomes it happens in brain, you can say that, and the person does uncontrolled movement. It has some emotional problems, yes, and he cannot think like normal babies. So these two are
Like,
related to brains and psychomotor. Then there is cancer and diabetes. So these diseases you can realize at you can diagnose them at an early embryonic stage. At this time, it is possible to filter your babies. It is possible to diagnose if your baby will have these diseases or not. Okay, so someone was asking a question.
yes,
Hmm.
disease of Huntington's is like autism.
You can say that the some of the symptoms are same of these autonomous diseases. Almost they are same. You are 17 years. Yes, you shouldn't ask me question. So uh, what if you
I
are
also would like I would like to ask this question regarding the same.
yes,
If
you are
there were
17 or
any
older?
much older, twice older.
Okay. Yes, you
So
can ask.
so I want to know if there were any researches, prolonged researches about the influence of such interference of a human in the nature of DNA. I mean,
This is again the question to the technologists. I am looking from a legal perspective. Even though I am a medical doctor, my first degree is in medicine, but I am not in a capacity to make comment on this, because number of researches are coming. It is like tea and coffee. Some people say that tea is good, some people say that coffee is good, some people say that tea is bad, some people say that coffee is bad. And it happens after 6 months, and new research come related to tea and coffee, and it is happening from previous 50 years. You can go on internet and you can find both benefits and negatives of this. Similarly, those who are working on this area, definitely they find positive dimensions. And some of the conservatives, among scientists also, we have conservatives who might be thinking that this is interference in the way of gods, and we should restrict our applied scientists activities and not to interfere in some matters which are in the god's hand. I don't have my personal opinion on this, even though I have, and I don't want to influence on your thought. But the point which I'm trying to make is that this topic is being explored, and everyone has its own convictions about this, and everyone can make its own opinion about this. So in USA, if you have a Down syndrome, you can pick an egg and you can screen your baby if you want. Uh, what is your
But
opinion? That
not
if,
only in the USA, for example, in Uzbekistan and Russia, they have the same researches while a woman is pregnant, and she can find out if she has some pathologies with her babies, including Down syndrome.
and then she is given a choice, yes?
Yes, she's given the choice to leave this baby or to make an abortion.
Hmm. Okay. So what if you are given a choice? Should you be able to choose a baby's genetic health? I mean, if someone gives me a choice to make a baby, perfect baby, and I think that it is, and if I feel that it is practically possible, definitely I will try to design a perfect baby. Yes.
Yes,
Yes.
sure.
Of course, people want healthy children.
So some of the areas, I mean, this is going to happen in upcoming future, that you will be able to design the IQ. You will not lose your hair if your parents have taken good decision. You will have good hair. Even you can have blonde hairs, perfect pitch of your voice, and perfect vision, and low risk of different autonomous diseases. This will be possible in near future. Uh, Beside this, what other factors you think that you will be able to do or you want to do in your babies? Hello?
Excuse me, what did you say?
It is written what I said. Which factors you would like to have in your babies?
Maybe some parents want their the babies be tall than others.
Strong immune system.
Yes. So what are the benefits? Benefits of embryo screening is that it will ensure your longer and healthier life. Yes, if you will have less diseases. And the cost or the negatives are, we will have less genetic diversity, because everyone will want long children, high IQ and blonde hair and high pitch and blah blah blah. Yes, white skin. People in Asia like white skin. No one likes people like me with brown skin, and people would like to have the long hairs of their children. So there will be less genetic diversity, yes, because our desired characteristics are same. We don't have much diversity in our choices of something being perfect. Yes.
Yes,
Yeah.
from that point of view.
And the question of what is valuable may change over time. Certain things which are valuable for us may not be valuable in future. How do value ourselves? What if baby who was screened to be a music prodigy turn out not to be? I mean, you designed your baby in a way that he will become a very good musician, but it happens that he becomes something else. What does this say about how we currently value disabled people or people with Down syndrome? Should we be questioning these values rather than reinforcing them? I mean, at this time, we have sympathy towards the disabled people. Uh, if we see a disabled people, we become some sort of sympathized. We have some emotional attachment towards them. Yes, we feel sorry for them to certain extent, and this is because of our value system. But what happens when we have designer babies? Will we be practicing the same values? Yes or no?
Yes, maybe because we will be sorry because of technologies they have this disabilities.
But people may not be sorry, and people will be saying bad things about your parents, that your parents didn't do embryo screening at the right time and let you suffer your life as a disabled.
Mm-hmm.
No.
No, we should ban that kind of embryo screening, because I think it will no it will how to say endanger the national identity, because as you said,
Oh,
every parent
that's too much Uzbek answer. We should save our chista krovnost. Yes.
Yeah, yeah.
no, I'm not a Nazi, but um,
Yes, you are right that it is a challenge for diversity. And I mean everyone has its own opinion about this, and I am not here to influence. By the way, you
But
know.
in the current situation, also, like sometimes people blame parents if the baby is a disability. Sometimes, for example, people say the mom, woman, should be careful. For example, this kind of thing, because when a baby is on woman,
Hmm.
they may fall down or they may have some problems, disease. That's why this baby has disability. So people may blame the mom.
You know, a real case scenario, that a girl was Uzbek, and his boyfriend, he was, I think, he was Tatar or Turkish, something like this. Yes, both of them, they were Muslims, and
Uh-huh.
both of them were my students, and both of them,
Uh-huh.
they came to me. And the girl was very good, and boy was, also very good. I knew them, they were my students. And the girl said to me that everything is fine, but my
Mhm.
mama says that you cannot marry this boy, and if you want to marry this boy, tolka chiris moi troop. And even though there is no problem, the only problem is that this boy is not from my ethnic group. And both of them, they
Mhm.
were studying in a very good university in Uzbekistan, and belonged to a very, you know high class, upper middle class families, very comparatively liberal, progressive, and democratic families. But just because of the ethnicity of the boy, the both of them, they were facing problem, because the mother was saying that she couldn't marry to the boy, and if she want to marry, she has to pass from her dead body, something like this. I mean,
Um,
this is something which is being faced by us on daily basis. Yes, it is not the only one
yes.
story. There are a number of other stories, and the things which we are discussing right now about embryo screening, you can just imagine that it is very advanced topic for this population, the population of Central Asia and South Asia, even Pakistan or India and Bangladesh or Indonesia, Malaysia. All of us, we have same cases. We are not
Mhm.
able to come out of our diversities, our natural diversities. How we will manage our artificial diversities when this embryo screening will be something practical? You can just imagine. Yes.
Mm.
Why you don't say yes or no? You should
In deep
Imagining.
thinking.
We are imagining. And if it's
Fakat तो
possible, we
вот это не решено, да, что узбек, киргиз, казах, юг, восток, even the language dialects, yes, that even the dialects, they are Uzbek,
yes,
but he
yes.
speaks a different dialect, and me, как она видит замуж за этого парня, да? Ужас, да, ужас. Какой позор.
And also love
Yes,
story.
yes, yes. Unfortunately.
And just imagine that we are talking about designer babies. Natalia, you give your comments. Natalia, you are diversity, so you give your opinion.
That's why you asked if I am studying in Tashkent State University.
Dr. Ammar,
Yes.
so you told us love story. So what was the end of this love story?
Still, the story is in process. They are in level 5, I think now. They are still in.
I guess still a progress, Miss Universe.
It's laughing for us, but
I have many stories like this. I many students consult with me about my opinion, but this is just was a most recent and related to Uzbekistan, so that's why I shared. But I delivered my point that why there should be a legislative framework and why we need. So what are the benefits? Benefits of embryo screening are the longer, healthier life. Potentially, we can eradicate diseases, means if there is a disease, we can find a solution, or those at risk can be identified earlier and given screening. Yes, if we realize that this person is going to be sick, we can do the management. And would privacy laws or regulations or bans on screening prevent the realization of these benefits? I just give you an example that if you have traveled during this COVID period, I have traveled during this COVID period from different cities to different cities and different countries to different countries. And you have to do the screening before boarding the plane. Before boarding the plane, you need to give your PCR test for COVID. And if you are COVID positive, you cannot board the flight and you have to wait until you recover. Just imagine that the medicine is advanced enough that they can tell you that you have this disease or you are going to have this disease. It will affect on everything. For example, you want to go for a job to a company, and company does this type of screening, and company knows that after 2 years you will be suffering with this disease. They will not hire you. Yes, why they will hire a poor person, or why they will hire a person on whom they have to spend money in terms of his health care? Because usually the company provides health insurance, and if the company knows in advance that you will become sick, they will not hire you from the first day. The
Of yes,
yeah.
they will choose another candidate which can benefit, for example.
yes, what is if insurance companies started to require this sort of screening? For example, insurance companies which pay for our healthcare, maybe they can do screening before giving you health insurance to see that you will be sick or you will not be sick. If the insurance company knows in advance that you will be suffering with a long life threatening disease, they will not
They
give you
will not
insurance in the first day.
include.
Yes.
Yeah.
Very interesting.
Is gene editing any different to embryo screening? So embryo screening, I told you the embryo has formed, but the genetic engineering means you artificially edit the genes. Okay, you do this by yourself in laboratory. So this will bring inequality. Rich people, they will have access to these technologies, and poor peoples, they will be suffering because they don't have money and time and stamina and energy and resources to do their embryo screening or genetic engineering. Imagine a world where everyone has had a genetic test reduced to a rating of 1 to 10 that describes genetic equality. Society stratifies on this number. How would this impact the society? Is this any different to what we have today? Yes, it is different. And if something like this happens in future, it will change our legal system. And there will be huge stratification. Stratification means the gap between different fractions of society will increase. You will say that ya krutoi patamushta, I have my genetic I have my genetic test and it shows that I have no problem. And other persons who belong to a poor family will say, unfortunately, I had a genetic test and I will be suffering with diseases. At present, at present for marriages in Pakistan, we do certain tests of male and female related to sickle cell anemia. It is a blood disease. And if you have this disease, you have to change your blood with regular interval. And it is advised by the government to do this sickle cell anemia test before getting married. Just imagine that governments make a regulation to do all types of genetic tests before any wedding. I can imagine that it will be very difficult for us to find our pairs. Yes?
In Uzbekistan,
Yes, of
before
course.
marriage, the girl and the boy should also pass some medical testing, including genetic test. But maybe not what you mean, because we have different countries, yes, and maybe different genetic tests. But I think it is right, because if you, for example, has some mental diseases or serious diseases, your partner should know about this, because he is going to start his life with you. So I think it's fair.
I don't think so.
What about
Because
Sudba? What about Atboga?
No, at any time we can say, oh dear, I'm sorry, I want to have children, but you can't, for example, so let's say goodbye to each other. I think it's fair.
You are
but
very
everybody is
cruel,
not.
Natalia. You are very stone-hearted person. Okay.
Everybody is not
I'm
perfect or
fair.
healthy throughout the world.
Hmm.
And what about others?
What about others?
No, everybody is not perfect or healthy throughout the world, and everything is perfect in your life. There isn't any interesting thing, because everything is on average and it's perfect. That's not interesting.
Okay, so
There should be some troubles and
let's do Amin on this and finish this this lecture. Okay, so it is done for now. It is done for now, and we will start our next and final lecture, which is about human rights and social cost of the goods, and we will be back in 10 minutes or 15 minutes. How much break you want? I want a break.